Good afternoon. My name is Susan. I'm from Heritage Audiology. So I'm going to give you a little information today about hearing and how it pertains to falls, and just also some basic information about falling. Can everyone hear me okay? Good. So first of all, I am at Heritage Audiology. We're on Rogers Road, and we offer a full range of hearing evaluations, hearing aids, tinnitus, which is ringing in your ears evaluations. And I've been doing audiology for almost 30 years now. I was previously at Duke, and then we opened up this office over 5 years ago. We have a second office at Briar Creek as well. So this is the office on Rogers Road. Just to kind of give you an idea, if you've been, how many have been there before? And I see a couple that have been there. So this is our office, just a quick tour. This is our sound booth, so that's where we go in for hearing tests, so it's nice and quiet. We know we're getting accurate results, okay? So we're going to talk about falling and aging. So unfortunately, according to the CDC, 1 out of every 4 adults will fall every year. So as you go up, your risk of falling is more likely. And these falls can have a lot of negative impacts. So we see people who fall and have to go to the emergency room. They have broken bones. They have traumatic brain injuries. And so it can even lead to death. And these falls not only can do a lot of damage to people, but it's a huge expense on the medical system. So they're saying that more than $50 billion every year in medical expenses due to falling. So we're going to talk about how hearing's related, but then also when the PT is up here, Alyssa's going to talk about ways that we can prevent falling too. So not only are there physical injuries, but falling can create a lot of emotional burden for people. Everyone gets very concerned that they're going to get hurt. They get embarrassed if they fall. People will feel like if I fall, then I'm not going to be able to have my independence. My family won't let me go out. My family won't let me do what I want to do. So people just get more and more nervous about it, and then therefore they'll kind of cut back on their activities to prevent those falls. So when we think about hearing loss, it can cause huge difficulties with communication, and a lot of people think that's where it ends, but there's a lot more that goes along with our bodies and our hearing. And so you can see there's a ton of different things listed on there. Some of them you might have heard of. A lot of people know that there's an increased risk for dementia associated with hearing loss, and that information came out of Johns Hopkins back in 2013, and every year there's more and more data about that. So that's one reason we always recommend hearing aids if you have hearing loss, because it's so important for your brain health. But there is an increased risk of falling. There's connections to high blood pressure and diabetes with hearing loss. So there's a lot of other factors that either the hearing loss can impact or these other medical issues can impact your hearing. So another study from Johns Hopkins showed that even mild hearing loss can increase your risk of falling by 3 times. So as your hearing loss gets worse, it's even greater chance of falling. And is that a surprise to a lot of you? Yeah, no? So, you don't think of, I have a mild hearing loss, well now my risk of falling is higher, but that is the case. So some reasons why, there's 2 main reasons. One is that because of your hearing loss, a lot of times you're not aware of the environmental just your environment. So is someone coming up behind you? Do you have a dog or a cat that's maybe come into the room and you're not aware of because you haven't heard them? And so whether it scares someone that there's another person right behind them, or they end up tripping over a pet, those things are associated with decreased hearing because they're not having that awareness. The other factor is that having the hearing loss puts a lot of cognitive strain on your brain. and that's associated with that dementia risk as well. But because of that, your brain is not able to give the resources needed to focus on balance and gait as well. So it's just overload on your brain, trying to hear better, trying to know what's going on, and that's going to come from somewhere else, unfortunately. So what can we do about this? We're going to talk some about getting a hearing test and why that's so important. But if you did know that you had hearing loss, properly fitted hearing aids are going to make you more in tune with your environment, make you aware of things that are going on. It's going to reduce that cognitive load because it's just less work for you to hear conversations, to hear what's going on around you. And so, I think we got all those. This is another study that came out of WashU in St. Louis, which is actually where I went to grad school. So I like to see that one. But not only do hearing aids make you more alert and aware of what's going on, but they're showing that it's improving your balance. So they've done testing for people with hearing loss with and without their hearing aids on, and showing that they do a better job maintaining their balance. And that's because part of your balance system is in your auditory system. So you're using that same information. And so hearing aids can be really helpful to reduce the risk of falling that way. Everyone thinks of hearing aids as what their grandparents used to have, these big bulky hearing aids that whistled, that were uncomfortable, and they have really come a long way. Hearing aids now are all completely digital, so they are programmed to your hearing loss. If your hearing changes, we just reprogram them. They're all rechargeable now, so no more changing batteries, buying batteries. You just charge them at night when you're sleeping. They are Bluetooth compatible, so people can listen to music and audiobooks and phone calls right to their hearing aids. And some of them, even on the apps, have a falls detection system, so if you fall, it can alert someone that you've fallen. So not as bad as it used to be, much better technology. They're all using artificial intelligence now, so that when you walk into a noisy restaurant, it makes it easier. So back to getting that baseline hearing test. Most people don't know that your insurance will cover a hearing test every year. So it's really important to get that baseline test, and we recommend people start doing that in their 50s, just so that we know, okay, this is what the hearing is if anything happens. If you say you had a sudden hearing loss or an infection, we have something to compare to. So like I showed you in the beginning, we have that soundproof booth. We use headphones. We're just getting a baseline hearing test, and it's just real important to have that information moving forward. Okay. Has anyone had a hearing test and felt like it was a big deal? It's usually pretty easy. It's about 20 minutes. Like I said, your insurance covers it, so no reason not to. Does anyone have any questions about hearing loss and falls?
My wife is wondering, do they have hearing aids that filter out husbands?
Definitely. That's when that app is really useful, because there's a mute button with that. So for some people, though, we'll disable the mute button if we need to make sure you hear her. Any other questions? Nope. Alyssa, you ready?
Thank you, Susan.
Sure.
So, thanks Susan so much for hearing us on the hearing side of the ears, and then now we're going to start and talk about the balance side of the ears. So the awesome thing is that there's ways to strengthen our inner ear and prevent some of those falls. So my name is Alyssa. I am a physical therapist at PhysioFit. Up here you can see a picture of our little team, and Danielle is with me today. We are both the vestibular therapists at PhysioFit. So if you have any questions for either of us at the end, we'll both be here. And then outside of being a PT, I enjoy reading and pottery. I actually took a pottery class from one of the instructors here, so she's awesome. It's a pottery instructor. And then I also, any chance I get to put my little dog Blue in the presentation, that is my wonderful buddy. So, all right, so the first question to ask is, what even is the vestibular system? Mumbo jumbo of words. And you can't reach it with a Q-tip, so do not try. But basically, to answer this question, we got to zoom out a little bit and ask ourselves what our balance system is. Hopefully you guys have been doing your exercises, so maybe you've noticed some different ways that you've challenged this, but there's three main components. We have our vision, we have our sensation, and then we have that inner ear portion, the vestibular system. So our vision is going to let us know what's going on in the environment. You know, how far am I away from something? Is something coming towards me? And just set the scene. And then our sensory system, you know, even though you guys are sitting in a chair, you're technically still balancing. You're feeling the chair underneath you, your feet on the floor, or maybe 1 foot behind you, and that's all information that's going to the brain to tell you what's going on. And lastly, that vestibular system is able to give information to your brain with, you know, what's going on. It's a sensory system that detects gravity and then head motion. So without vision, without sensation, you should still be able to know kind of what's going on, and if you're moving, which way is up, which way is down, forward, backward. So it's pretty important to be able to detect, and if things go wrong, you can see where that could be debilitating. But overall, all of these systems have to communicate with the brain constantly of this information coming in and out so that we can stay upright or stay in any position that we want to. So there's certain things that we want to look for to see if we're having any decline in these systems. So there are, unfortunately, some age-related changes that happen, but these overall, they're subtle, they're gradual. Maybe some unsteadiness, or maybe needing to use some surfaces to keep your balance here or there. But it's also a use it or lose it scenario. If we aren't using some of these systems, aren't keeping our muscles strong, then your brain's gonna be like, oh, we don't need that. We don't need that. So it's really important that we do challenge those systems. But on the other side, we have specific vestibular conditions. When something goes wrong, there's inflammation in the ear, or has anybody heard of crystals in your ear? Yeah, okay. It's not crazy. There are some crystals in your ear, and you probably know somebody who's had something wrong with them, but if those become dislodged, it can be a sudden, intense dizziness or spinning sensation. Some people get super nauseous or even vomit, and again, these are like a sudden red flag of something's wrong when I woke up today versus this is, you know, declining over time. Some people even tell me that their head doesn't feel like it's attached to their body, or they just feel weird and off. Sometimes it's hard to describe. So hopefully from that information, you can know when the time is to ask for help. So especially if any signs of a vestibular condition has come up, ask for help. Like, call somebody. A vestibular PT should be able to at least diagnose and get you in the right direction, or seeking something so that you're not just going through your day with spinning and trying to prevent yourself from falling. There's ways to treat that. But also on the other side, if you're getting past this threshold where you're super unsteady, or you're having lots of falls, or even near falls. A lot of times your doctor will ask you, have you fallen? But sometimes they don't ask you, have you nearly fallen? And that's an important question. Is that number increasing? Again, that surface reliance. Are you able to walk without, you know, holding onto the walls or the couch? And then the other big thing is, can you strengthen your systems on your own? And if you can't do that safely, then that's another sign that, hey, I need a little bit of assistance to get me to the point where I can, you know, go through an exercise class or have tips and tricks to be able to do that safely. Because it is really hard in the balance field on your own. You know, we want things to be safe, but we also need them to be challenging enough to have that progress. So finding that middle ground can be a challenge, and sometimes we need help with that. And the other big one too is fear. Susan touched on this really well, but just the fear of falling itself actually increases the chances that you're gonna fall. So working with somebody to decrease that fear and have more confidence and be able to be active can really, really help. Oh, and then I wanted to bring these up too. I don't know if you can see these well, but we have a really cool device in our clinic called, they're infrared goggles. So if you put them on, it looks pitch black, but we can see your eyeballs on the computer screen, which gives us a lot of information. So they're really helpful to, remember I was talking about those crystals, if they become dislodged, there are certain presentations of eye movements that happen in certain positions. It's called a positional vertigo. And so the goggles let us specifically diagnose what's going on, where that is, and also how to treat it effectively. So it's a pretty cool piece of technology that we can use. All right, so those are all like the sad things that things get a little bit worse over time and things like that. But the good thing is we can take control of certain factors. We can do things in our environment, and we can do specific exercises, which is awesome. So first, some daily tricks, which I think you'll get more information from some other speakers as well for ways to make your environment safe. But overall, just moving a little bit slower when you stand up or get up. And everyone hates to hear this. Like, nobody wants to do this, but if you can create your little habit, maybe you like, I don't know, sing a line of your favorite song in your head, or take 3 breaths or something like that. But just to give yourself a second to calibrate, let your vision focus, things like that. And also with your vision, focusing on a target while you move can be really helpful, especially in busy environments. So let's say you're in the grocery store or the airport, there's people walking by you, there's noises overhead, lights, all of those can be factors that can make things feel a little bit more unsteady. And so having that ability to focus on a target while you're moving can help you stay better stable. So, and again, along with vision, keeping a room well lit can really help. And using technology to help you. So if you know there's going to be a area that you're going to turn the light off, but then you have to walk all the way over in the dark, it's not going to work out so well. So whether it's a motion detector light or a remote control light, or I'm really sad that like the tap on, tap off disappeared, but we've got those, that might be great. But use what you got to help you out and be smart. There's lights that turn on when things go dark, or like the bathroom and things like that. But think ahead of your environment to help you out. And then lastly, just staying physically active, especially with things that are rhythmic, coordinated, throwing a ball, dancing, Tai Chi, all those things just help integrate all those systems, visual, sensory, vestibular, and help them make you stronger, but also hopefully are a little bit more fun too. All right, so then we've got some overall lifestyle choices. So staying hydrated and nourished just to help our body systems, but also I really encourage you to get your vitamin D checked if you haven't. Vitamin D has a specific concentration in the inner ear, and it has a correlation with those crystals that we talked about. So if you have a lower level of vitamin D, you can be more predisposed to having a positional vertigo. And it's something that's easily checked with blood work. Sometimes you do have to ask for it though, so just check in with your doctor and see what those levels are and if you need any supplementation. And then while you're at the doctor, giving a little conversation about medications. Some medications have side effects that can affect your ears or balance. Even just having a multitude of medications can affect your balance. So And even too, if you have multiple practitioners that are prescribing things, somebody needs to be on the same page and make sure everything is needed. So, and lastly, Susan hit home on this one, but just getting hearing and vision checked, getting those annual checks to see if there's any major changes, keep systems fine-tuned. All right, so my favorite, exercise. So I kind of give us 3 different categories here of exercises. We have stationary balance, which would be anything that you're trying to stay stable, any position. It could be sitting, standing, different foot positions. And then on the other side at the bottom here, we have dynamic balance. So that's anything where you're moving. That could simply be walking. It could be walking backwards, walking sideways, whichever way. Again, that environment though does make a difference if it's busy versus quiet. And then the middle one is gaze stability, and this is really important for that vestibular system. So there's a specific reflex with our ears and our eyes that when I'm looking at you, I can turn my head and my body and keep that camera in focus. And if we didn't have that, our world would look like a shaky camera. Wouldn't be fun. I don't know if you have any old home videos, really. But so we can train this and get it to be more fine-tuned and get these systems to talk in a very fun way. So we're going to try to go through some exercises, but if you do not feel comfortable or safe doing them in this environment or on your own, then feel free to pass. Obviously, safety is our #1 concern, so just keep that in mind. But on your sheet that you have, I gave you guys this continuum, which hopefully isn't too confusing, but it's on the back side. But basically in the far left, we have the easiest position for us standing is a wider base of support. Anything that's going to make the stance more narrow from there is going to be more challenging. And again, if you have any hand support too. But it's good to know what this continuum is so that you can have a little bit of control and fine tune, like a knob on a radio. So especially for your exercise class or whatever you're doing, if you're going to stand wider stance, you should be a little bit more stable, but that might be challenging if you use a walking aid or a rollator. But from there, coming into a more narrow stance, feet together, would be a little bit more challenging. Then we have a staggered stance. I'll do my hands too. A staggered stance. From there is walking like a tightrope tandem. That is pretty challenging. And then progressing towards a single leg stance. So the cool thing is there is some normative data that's been done on where you should be able to hit that single leg stance, standing on one leg, based off of your age and sex. So and if you're super competitive, maybe you want to be in like the age range below where you're at, right? Just for longevity. But this isn't to say you have to do single leg stance, but it does give you some ideas and maybe some goals of where you want to work towards and increase that strength. So we're going to come back to this narrow stance. So whoever wants to participate, I'm going to have you guys stand up and we're going to do 30 seconds of standing in a narrow stance. And that's going to be different for each person. If you don't know where that is for you, I would encourage you to start at that feet together position and see how you do. And if you need your chair for support, that's totally fine. But whoever wants to try, go ahead, stand on up, get some blood flowing. And if you want to put your chair by the wall or the table, that is totally okay. All right, awesome. And then whatever position, we can have, got some helpers in the back. Whatever position that you're going to choose, go ahead and come into that position, see if you need an assistance of a finger or a hand on the side. And we are starting our 30 seconds now. See what you guys got. Awesome job. So you should feel some of those foot muscles working, maybe a little bit of sway. You guys look good. Nobody's on the floor. solid, halfway. The other thing I've noticed is while doing some of these exercises, 30 seconds feels like a very long time. Yeah, somehow time gets longer when you do balance exercises. 3, 2, 1. Good, come on out of that. Nice, I saw a good variety of stances. Nice job. You guys can take a seat again for me. So maybe this gives you a marker too of like where you're at. If that was easy or hard, you can use that continuum to see how you can progress yourself towards maybe a more narrow stance.
I have a question. I understand the connection between hearing and vision, but I don't understand the vertigo. In other words, is vertigo something that happens because of balance, or is it something that's related to some other medical problem?
So it depends on what the source of the vertigo is. Technically, vertigo is described as like a spinning sensation. A lot of times for true vertigo, people's eyes will also shake back and forth. It's called nystagmus. And it can be from a couple sources. Sometimes people have an infection in their ear, inflammation that affects the nerve. Sometimes it's from those crystals being dislodged. So those sources of vertigo technically are separate. Some of them are more likely to happen as we age, but still as we age, we can have a decline in those systems as well. Does that make sense? Let me answer your question. Okay. All right. So then our second one of stationary balance is taking out the visual component. So again, if we think back to those 3 systems of balance, anytime we decrease or remove one, we're going to challenge the others that are left behind. But we rely on vision a lot. So that's why I put these wonderful caution signs here, because this is really, it's challenging. I don't know if you guys have tried this before, but just even sometimes for people sitting upright in a chair, closing their eyes can be enough to have a little bit of disorientation. But I would encourage you, whether it's sitting or standing, to start in a normal stance position with something in front of you that's sturdy, and trying to close your eyes and stay balanced. If you start to lose your balance, open your eyes, readjust, reset. But this is a really good exercise to try to start to get those inner ears to be stronger and even to feel the ground. The other variable, which we brought with us today, if anybody wants to see it, is doing things on foam. So that's the other component. You have your sensory system. So if we put you on foam, it's going to be harder to feel the ground. So then you're going to use that inner ear a little bit more in your vision. So there's tons of fun combinations that you can do to challenge these different systems. So whoever wants to try the eyes closed balance, again, you can do this seated and just kind of scooch up on your chair, or if you'd like to try it standing with your chair in front of you, go ahead, stand up now. And the last one I wanted to bring up, which we can try with you individually afterwards if you want. The space doesn't really allow for it, but just the ability to move forward while doing head movements too is also really important. So again, think of that like grocery store scenario, prime scenario for vestibular therapists to bring up. We've got lights, we've got thinking about our grocery list, but also we're looking at what's happening on the shelves and reading and going back and forth and grabbing things. All things we need to be able to do, or even to get through our home and look what's happening and going on without getting twisted up or losing our balance. So again, speed is a matter, how we're walking, if we're using any aids at all, but it is something that's important to be able to train and can get better with. So yeah, we won't try this one specifically, but I wanted to give it to you so you knew there's other ways of challenging that vestibular system. And then specifically for evidence-wise, there was a systematic review done in 2019, which is when they look at a bunch of different research articles and see what's the overall evidence, and found that exercise programs that include balance training can reduce the risk of falls by up to 42% in older adults. Like, if your doctor told you, I can give you this magic pill and it's going to reduce your chance of falls by almost half, you'd be like, yeah, I'll take that. And obviously, strength training is along those lines as well, and we talked about some of the other coordinated movements or dance can help. But it is really important that we stay active and even staying social with our activity to help with overall balance systems and decreasing that chance that we have a fall, or how we recover from a fall if we do. But what questions do you guys have?
I think it's unfair. I would suggest it's sexist. From 70 to 79 acres, I have to stand on my foot 18 seconds, and my wife only has to do it.
That's what the data says. It's not that she has to. I mean, it'd be great if you can do more, but yeah, unfortunately there's that difference between sexes.
As a midwife, I do like the list of activities to help maintain balance, did not include cutting grass or vacuuming.
We're going to add that to the list real quick. Specifically, the men must do those activities. In the back.
You said at the beginning that there is physical therapy that helps with vertigo. What can you do to help? I'm prone to vertigo. I had a significant attack a couple of weeks ago that took me out for 3 days.
Yeah.
When I went to the ear, nose, and throat guy 100 years ago, he gave me this procedure called an Epley maneuver, which makes it a whole lot worse before it gets better. What can physical therapy do?
So it depends on what the source of that dizziness is and that vertigo.
In your ear issue.
Yeah. So if it is the positional vertigo, then it's going through specific maneuvers. Whether it's the Epley or there's some other maneuvers to get those crystals back where they belong. So yes, it does get a little bit worse, but that's where we use the goggles specifically to diagnose specifically what position those crystals in and what's happening, so that is more effective. But on the other end, if you have any like inflammation that's in the inner ear, then it's going through some progressive vestibular specific exercises. So one of them is doing like the head shakes, but it's specific to whatever dysfunctions that you have, what's coming up that you're struggling with. So it sounds like it might have been you've had history of positional vertigo, but.
I was surprised along with the slide indicated vitamin D can actually help improve the crystals.
It helps in the solution. There's a fluid in the inner ear that's supposed to be there, and that has vitamin D in it, and those crystals are made out of calcium, and so they have a natural life cycle that happens. And the balance between the two makes sure that stays healthy, just like our skin cells kind of slough off. So if you have a lower level of vitamin D, it can affect just that health of the system. But did I answer your question in the back?
I guess I'd have to try it, because for 20 years I've been throwing my head off the side of the bed to shake everything loose and then to sleep for 17 hours. I'd have to try it with therapy to see if your goggles work.
Yeah, again, it depends on like what the source is and having the correct diagnosis, but.
Like I was telling you, 20 years ago, the doctor said it's the crystals in your head, and here let me fling you back in this chair and we'll loosen everything up, but you're going to feel terrible for a couple of hours. Well, thank you, and now I get to drive home. So I've just been going the same old route for all these years.
Yeah.
We use the physical therapy could do something.
Yeah, and sometimes too, even if it is the positional vertigo, sometimes after that, people are left with still having a disorientation or feeling off. Things didn't come back to 100%. And so we work with people too on getting that to be strong again and specific exercises for that. So, any other questions?
Does Dramamine help with vertigo?
Good question. He said, does Dramamine help with vertigo? It depends. Great answer.
My PCP doctor suggested Dramamine.
So it depends on what the vertigo is coming from.
Yeah.
Sometimes it can help more with like motion sickness,
Mhm.
but it's not going to help if there's like the crystal of positional vertigo. Some people will take a certain medication for symptom-wise to help with like the nausea, but it's not going to cure the vestibular dysfunction. So it's more for comfort. More for
You feel
comfort,
better.
for symptoms, yeah.
More of a company.
Maybe rather than fix it.
Yeah. But also, even just using peppermint or ginger can help with some of those like off feelings or feeling nauseous, which is nice because it's a little bit more natural, and I like the smell of peppermint. Does that help?
Yes.
Does scents, fragrances, and that sort of thing affect? Can they affect your balance?
Balance? In a sense, yes. It's one of those factors of like busy environments.
Mm-hmm.
So like one of the worst places is going through the mall. But like heading through a department store where there's lights, sounds, bright colors, and then you've got like the scents happening can be more disoriented. There's nothing specific of like this scent is gonna make you dizzy, but the only opposite is sometimes peppermint and ginger can help with calming. Yeah.
So I should tell my wife I should not go shopping with them.
Definitely. Calm stores only. Any other questions? Really great questions.
And peppermint and ginger, eating them?
Usually smelling peppermint. Ginger can be usually
Digested?
eating.
Okay.
How about lavender?
No.
What did you say?
That's funny. So lavender is more on like the calming side, but I actually am more allergic to lavender, so it doesn't calm me at all. So it depends on your tolerance to certain smells as well, but it's not specific.
I
So.
used to spray lavender on my pillow, and it gave me a rash.
Yeah.
Concentrated.
Yeah. So I wouldn't recommend. Learn from this guy.
Along those lines, my wife's Vietnamese, and Diana, the Vietnamese actually have they call it Yosan. It's a green medicinal oil. They'll actually put it under the nose, and it does seem to help. And I assume it's some kind of peppermint.
Yeah. Yeah, I think sometimes too, scents have a powerful connection to like the emotion center in our brain. So sometimes it can just be used for grounding and like being in the present moment. But
My question is about flying.
okay, yeah.
I know that my ears always get stopped up, and I have on occasion had them completely stop up and not open for like 3 days. So everybody sounded like Darth Vader. Is there something that you can recommend to avoid that or help that?
Avoid flying.
Take a train, yeah.
Susan is actually going to speak on this one.
A lot of times when people have that issue, it has to do with their eustachian tube not being able to open and close properly. So I know some ear, nose, and throat doctors will recommend taking a decongestant a couple of days before you're going to fly to kind of prepare for that, if you can take that with any other medications that you're on.
Gotcha.
That can help. just like we do when we're traveling with babies, if you're allowing them to drink and chew gum and things like that, that will help if you can't take the decongestant.
Okay.
Yeah. Sucking on a lung.
Yeah.
Sucking on a lollipop, gum, salivary glands, sinuses. Good questions. Anything else? No? Last chances?
So, if I came and made an appointment with you, you could check some things out about my vestibular system?
Yeah, I mean, it depends on what your specific concerns are and goals, but we do test, balance testing and vestibular testing of what those specific deficiencies might be and where you could supplement with certain therapies. So, but also just going through like your exercise program or with this group or with Christina, of seeing where you are with that and noticing progressions. Yeah. Anything you want to add or?
Any questions?
Oh, did I miss it?
No, I really appreciate this information. I think it's super valuable for you all to understand your bodies as much as possible. And I missed some of the presentation, but I really liked the part where she was talking about how important it is to do it at the proper distance and the proper speed. And I mean, there are specifics to training this system. So it's not like go on YouTube, find an exercise and do it. You need to learn how specifically to do it for you. So that's why it's so important to have these specialists in our area that can help and fine tune you so that you are working at your best possible capability. So thank you so much for your knowledge.